Mr. Chairman, and thank you all for being here. Ms. Troy Ono, thank you. I hope I said that right. Being from Georgia, I can add an extra syllable with ease. But thank you for being here. And as a small business owner, thank you for your testimony, your insight, and thank you for fighting through and keeping on. We do appreciate that. So, Mr. Whaley, I'm going to kind of start with you and just kind of give us some insight here. Just simple questions. Right, compared to a decade and a half ago, is healthcare, or is the cost of healthcare in America more or less at the individual level than it's been than it was 15 years ago? Americans paying more now than we were.
Substantially more.
Substantially more. Is America more healthy today than it was a decade and a half ago?
Not to the same level at which prices have gone up.
Okay. Is there data, and a genuine question here, does data exist that shows utilization of the system through different income groups? Meaning, we talk a lot about access to care and creating access to care. Access to care is very different than utilization to care. Are you aware of data that exists that shows that people in different income stratas, even if they have access to care, do they utilize that care?
We do know, not through a single data set, but through data sets that we've been able to piece together differences in utilization and types of providers based on broad differences in income.
Okay. With that, if you, and again, I'm going to put my provider hat on of having a private practice, a dental practice, in which my patients, whether they were Medicaid patients, whether they were employed by one of the major employers, whether they had unlimited wealth, all of my patients got treated the same. Same appointments, same access. It's just the way that we operated. And what we found is that even if someone had access to care, many times on the lower end of the spectrum, because of a variety of other issues and emergencies that they were dealing with, and the fact that they were living in the crisis of the moment, they simply didn't access the care. They didn't utilize the care. So when we talk about price transparency, and we should, because I think it's important for Americans to know the real cost of health care. I think it's important that we all understand the real cost of health care. I think it's important that employers do, and we're able to make decisions based off of that. Does transparency solve all of the world's problems? No, but it is clearly an outlet or an inlet for us to understand cost in the healthcare system as patients and employers do. But shouldn't we be transparent in the data as well, and how different groups are utilizing the system? Because if you have a group that may have access to care, but they're not utilizing the care, is that creating a problem in terms of still having the catastrophic events that drive cost up so high? I mean, Ms. Troy, no. Again, I'm sorry. But with your employees, do they all utilize the system the same way, or do you have employees that only go in at catastrophic events?
We encourage our employees. Everyone who's on our health care plan has to see their primary care physician at least once a year. So they have to turn in a biometric screening to a company, and they are required to do that. Part of the problem is the insurance companies are a big part of this problem, because they dictate to the primary care physicians what lab work they can have done. They dictate what tests need to be run.
Let me grab you, because I agree with you on that, but I've only got a few seconds here on this. But price transparency and understanding where those dollars go is obviously important, particularly at the hospital level in the enforcement of the rules. But Dr. Whaley, can you provide us or be willing to work with the committee to get utilization data across the board and maybe work with whoever you need to so that we can understand not just access to care, but utilization of care and consistent utilization of care and the lack thereof, what is it doing to lead to these higher costs? So,
Absolutely, and I agree that that's critically important.
thank you, Mr. Chairman.